Hi, I'm Dr. John McAllister. I'm going to give a talk to you on arthritis. All of the information that I'm going to discuss is available on the St. Peter's Bone and Joint website. So if you listen to this talk, we've diagnosed you as having arthritis. Arthritis in Latin literally means inflammation of a joint, and most arthritis is related to just general degeneration of a joint or aging. We can do things that increase the likelihood of getting arthritis. Trauma from sports when we're younger, or accidents. Obesity certainly plays into it. There's other types of arthritis, such as rheumatoid arthritis, that's an inflammatory problem. But that's a special type, so we're going to focus primarily on degenerative arthritis. So what arthritis is basically loss of articular cartilage. All the joints that we're talking about that move are lined with articular cartilage. It's a very slick, low friction surface that has some cushion built into it. It lubricates itself, and it's a living tissue. But unfortunately, over time, it can degenerate and wear out. And that begins to cause problems with pain and swelling, typically in joints, and over time can develop stiffness as well. So articular cartilage, this is a knee model. We're going to move the kneecap out of the way, and this is the articular cartilage that covers the ends of the bones here. The knees also have an extra piece of cartilage called the meniscus, the medial and lateral meniscus, but there's cartilage that covers the tibia here and the femur here. And it can be in a knee or a shoulder or any other joint, really. But as that begins to wear, the bone sees more pressure, and as a result of seeing more pressure, it begins to grow spurs. And the spurs are not really the cause of the problem, but they're there because the bone is seeing more pressure and they grow slowly. We can remove all the spurs from an arthritic joint and people just don't get better, so we've abandoned that surgery probably close to 100 years ago. The treatment for arthritis it really depends on the stage or how bad the arthritis is. And I sort of break it down into exercise, pills, shots, and surgery. In exercise, there's different things that we can do. Physical therapy can be very helpful for a specific joint that's beginning to have problems, maintaining range of motion and strengthening. And often therapy is helpful because if I tell you to go make your knee stronger or your leg stronger and you're having problems with arthritis, you may just start to have more pain and be unsuccessful at that. So we do often use physical therapy. Things like walking, bicycling, swimming can also be helpful. In general, weight loss is key. If you're overweight, it will help. The knee sees about 5 times your body weight in forces when you go upstairs or get up from a chair. So losing even 10 or 15 pounds can certainly make a difference to a knee joint or hips as well. There's also braces, particularly for knees, not so much for hips, but there's braces that we can use to stabilize a joint that may make walking and exercise more comfortable. There's different types, and we could talk about that individually. Also, using a cane or a walker can be helpful. A cane typically in the opposite side, so if you have knee pain in the right knee, you'd want to use the cane in the left hand, or in really bad cases, a walker can be helpful to prevent falls and decrease pain to get around. After exercise, we have pills, and there's lots of types of pills. Probably the safest thing that you could take for arthritis is Tylenol. There's also anti-inflammatory medications. There's over-the-counter medications like ibuprofen and naproxen that can be obtained without a prescription. And then there's prescription drugs just like those. They're just stronger doses. Some of them are more convenient. They maybe that you only have to take once a day. All these anti-inflammatories in general have a risk of stomach ulceration. They can raise your blood pressure. They can cause kidney problems, and there's an association with increased risk of heart disease. So we don't take those medications lightly. They do have some risks. Probably for short term, it's not much of a risk, but it can be if you're taking it over a course of years. Especially for older people, those drugs do have some risks. They also are available in topical forms, so they can be rubbed on the skin and probably have less risk of stomach problems if you're using an anti-inflammatory that can be applied as a cream. I think those can be helpful if the area of pain is very close to the skin particularly. There's also just pain medications such as tramadol. It's a non-narcotic pain reliever, and then narcotics for pain as well, although there are some long-term problems associated with using narcotics on a long-term basis for pain. And if you ever have surgery and you've been taking narcotics for years, you'll have a harder time getting pain relief after surgery. So we try to avoid those as much as we can. Then we have shots. Usually we use cortisone. The knee injections are not particularly painful. I think there's some people giving bad shots. It's not me. It shouldn't be that big a deal, probably not much more than getting your blood drawn, but they can be very helpful, a much quicker fix than pills. And for some people, it's less risk, I'm sure, to have an injection versus having a medication long term. There's also viscosupplementation. We use Euflexa right now. That's a hyaluronate that can be injected. Usually we do 3 injections a week apart. There may be some advantages to it. It's much more expensive. We typically try cortisone first, and if that doesn't work or doesn't help for very long, we move on to the more expensive types of injections. They have to be approved by insurance. There's also PRP, which is, some people are calling it stem cells. It's controversial to say the least, and it's not been shown in any scientific study to be helpful for arthritis, but it's available. People are injecting it. I'm not doing that into joints right now because I have to sleep at night. And then lastly, there's surgery. And the typical surgeries that we think of for arthritis can be arthroscopic surgery. It may be helpful for knee to clean up a meniscus, maybe remove loose bodies. But it's not a cure for arthritis, and sometimes in earlier stages it can be helpful, but it's definitely not something we move too quickly. And then lastly, joint replacement in cases where basically all these other treatments have failed, then we start to consider joint replacement. Thank you.